Knee replacement is a very common and safe surgery which allows patients to mobilize most of the times without any issues. A lot of our patients and their families will come to us and say, I have seen the surgery and it looks very gross. I've looked at that video, this video in the YouTube, and they have few questions about actual process, what happens in the theater. It is important to know before you go for the procedure so that it will keep you comfortable. Once you're admitted for surgery, we'll take you into the preoperative area. We'll make sure all your vitals are normal, and then you'll be taken into the theater. In the theater, the anesthetist will give you anesthesia, majority of the time spinal anesthesia, because there are good advantages with that. So once the anesthesia is complete, then you'll be lying flat on the table, and we clean the area with any of the antiseptic agents so that we can prevent infection, and then isolate the area by applying all the drapes so that only the surgical site is exposed. This part is very critical in preventing infection. Once that is done, I'll go ahead with the surgery. First cut in the soft tissues, skin, muscle, and then go to the joint, expose the bone and remove all the arthritic bone away, implants using a bone cement, and then close the wound. This usually takes around 1 to 1.5 hours depending upon the severity or complexity of the surgery. Once the wound is closed, there will be a dressing, and then on top of that we'll put a compression dressing to reduce the bleeding inside. Some surgeons may use tourniquet. I don't use a tourniquet because that reduces the swelling, and also it will be less painful post-surgery. And once all this process is done, then you'll go into the ICU. This is the usual seamless process which happens in theaters.